Chapter 8, An Integrated Model of Healthcare Delivery by Stephen Wintz and Kenneth Museman. This chapter summary tries to highlight the useful components from an otherwise repetitive and vague chapter. It suggests that healthcare engineering can look at 5 barriers in the current delivery of healthcare and pose solutions on how this can be improved. Like everything in healthcare engineering, there is a move from event-driven healthcare to process-driven care, and change is required at all levels from provider to care team to organization to the broader environment in order to make process-driven care possible. The 5 barriers are complexity, fragmentation, the shift from a chronic to acute care, healthcare informatics and communication technology, and linking system performance and goals. Within complexity, 2 ways that industry has addressed this outside of healthcare include microsystems and care platforms. Microsystems are the smallest functioning group of people that can work together, a minimum replaceable unit, and they have shared aims and shared outcomes. The book doesn't specify specific examples, but suggests that multiple microsystems could work together in a healthcare delivery system. The book also suggests care platforms, which function as a unit of service, and this is a standardized delivery unit which can be delivered as a group of shared services to patients with similar needs. In the concern of fragmentation, the concept of care episodes is raised. These are a combination of microsystems and care platforms. And when you bring the microsystems and care platforms together, you can create a care episode. Care episodes can be linked together to reduce fragmentation during the management of either an acute or chronic medical condition. Unfortunately, the book states there's, quote, neither a generally accepted definition nor a fully implemented application of care episodes. With regards to how to measure the outcomes of care episodes, the book suggests 2 interesting observations. First, that the outcomes measured should look at outcomes that can be measured from conditions that span multiple care episodes, as a means to help promote integration in an otherwise fragmented system. The second is to measure outcomes which are success based on patient outcomes, and this metric moves the focus away from the system actually towards care of the patient. The third question is how to address acute and chronic care, and the concept of care cycles is proposed, which is a tool that can measure multiple care episodes. And because of the ability to link multiple care episodes together, it is best to use a care cycle often when thinking of chronic care. The 4th area of concern, health informatics and communications, obviously is a disaster. The book notes that paper records have many problems, such as the difficulty of only having one person or one organization hold the paper record, and the difficulty with tracking and aggregating data in real time. We'll skip over the rest of this section just given the inherent problems with health IT. The 5th and final area of concern is the trouble with linking system performance and goals. There's not consensus between groups on what the goal of healthcare is. And the Institute of Medicine in 2000 tried to suggest 6 goals, which, as we mentioned before in the previous chapters, are making healthcare safe, effective, patient-centered, timely, efficient, and equitable. Ultimately, this chapter suggests that an integrated healthcare model will be the best option to try to reduce these concerns. And during this, there's always the balance between trying to create standardized processes and at the same time customize care for individual circumstances. There's always the tension between measuring outcomes for individual specific and for populations on the whole. To summarize, microsystems and care platforms can help manage complexity. These can be joined together to create care episodes which help with fragmentation. Care episodes can be linked together to create care cycles, and this helps with chronic care. And this can be supported through better health informatics and communication technology and measured with shared performance goals.